Hello everyone. Today we will discuss about Glasgow Coma Scale or GCS. The Glasgow Coma Scale is a neurological scale used to assess a patient's level of consciousness based on eye opening, verbal response, and motor response. It is mainly used in cases of head injury, trauma, stroke, or coma to quickly evaluate brain function. In short, GCS is a simple and reliable tool to measure how awake, responsible, and oriented a person is. Okay, let's break down the Glasgow Coma scale step by step so you can understand each and every point clearly. GCS has three components. These are eye opening, verbal response, and motor response. Each has a score, and the total score is 15. For the first one is eye opening. It has 4 points. Spontaneous, it's marked as 4. Patient opens eyes without any stimulation. Example is patient lying on bed, opens eyes and looks around on their own. It's marked as 4 or spontaneous. To sound, it's marked as 3. Here patient opens eyes when called. As an example, if you say, Mr. Roy, can you hear me? And patient open eyes, then it's marked as score 3 or E3. To sound, or E2, it is a to pain. Here patient opens eyes only when given painful stimulus. Example is nurse press patient's nail bed or applies sternal rub, and then patient opens eyes, then it's marked as E2 or to pain, or E1 is known as none, no eye opening at all. Example is even after calling loudly or giving pain, eyes remains closed, then it's marked as E1. And second is verbal response. It has 5 points. V5 is also known as oriented. Here patient speaks normally, knows their names, place and the time and date is. Here if you ask the patient about what's her or his name, where he or she is, and what is the time that patient is answer it correctly, then it's known as oriented or mark as E5. V5. And second is confused conversation or V4. Here patient speaks but is disoriented. Here patient says name correctly, but this says about date and time and place it's wrong, and it's also known as confused or it's marked as V4. And V3 is known as inappropriate words. Here uses random or unrelated words. When you ask them what is your name and patient says banana, car, etc., then it's marked as V3 or inappropriate words. And V2 is also known as incomprehensible sounds. Here only moans, patient only moans, groans and makes noises but no clear words. Example is but not forming words. Then it's marked as V2. And V1 is none. V1 is also known as none. Here no verbal response at all, silent even after pain or repeated questioning. If you questioning repeatedly or if you give any stimulus, then patient has no response, that it's marked as V1. And last one is motor response. It has 6 points. M6 is also known as obeys command. Here patient follows instructions such as If doctor says lift your right hand and patient does it, then it marks as M6 or obey's command. And another one is localized pain. It's marked as M5. Here patient moves hand towards the painful stimulus to stop it. Example is nail bed is pressed and patient pushes examiner's hand away, then it's marked as M5 or localized pain. And M4 is withdraws from pain. Here patient pulls limb away from painful stimulus. Example is pinch them on arm. If you pinch them on arm, patient pulls arm back but does not localize where the pain is, then it's marked as M4 or withdraws from pain. And M3 is also known as abnormal flexion. Here patient's arm flex abnormally to pain and legs may extend. Example is if you apply pain, patient's arms bend inward to chest and fist clenched, and it's known as or it's marked as M3. Or M2 is also known as abnormal extension. Here arms and legs extend abnormally with pain. Example is if you apply pain, then arms stiffly extend and wrist turn outward, then it's marked as M2. And M1 is also known as none. Here no movement at all. Here patient is completely flaccid, no motor response to pain, then it marked as M1 or none. If the total score is 15, then patient is known as fully conscious or normal. And if the score is 13 to 15, then patient is having mild brain injury. And if the patient is having 9 to 12 score, then patient is having moderate brain injury. And if the score is less than 8 or equal to 8, then it's all known as severe brain injury or coma. And if the score is 3, means patient is coma, means deep coma or no response. Thank you so much.